Hello everyone. So this class we are discussing around various ocular formulations and especially the Ocuserts. So we studied the anatomy of the eye, the various types of barriers that limit the permeation and various methods to overcome the bioavailability or increase the permeation, and various types of dosage forms, novel dosage forms also we discussed in the previous classes. Today we are especially discussing on the Ocuserts or the ocular inserts. So ocular insert, they are defined as sterile, thin, multi-layered, drug impregnated, solid or semi-solid consistency devices placed into the cul-de-sac or conjunctival sac. So this is the definition of an ocular insert. So based on this definition itself, we can grasp an idea about how an ocular insert is supposed to be. So they are sterile. It's very mandatory thing that the ocular preparations must be sterile. It's not only with the ocular inserts, but also with the other type of preparations also it should be sterile, or else there will be highly pathogenic infections can happen to the eye. So it should be sterile, then it should be thin because we are inserting this into the eye, inserting this into the ocular cavity. So it should be thin, then there only the normal functions of the eye will happen. Then they are multi-layered, they are impregnated with the drugs. That means they containing the drug, and they can be either in the solid or a semi-solid consistency devices. So this is the characteristics of an ocular insert. So the shape and size, the shape of the insert and the size of the ocular insert is specially designed so that it can be properly inserted into the ophthalmic cavity. And they are made up of certain polymeric materials which may support the drug, which may help to hold the drug. So they have the potential advantage in improving the patient compliance by reducing the dosing frequency. The basic concept of this ocular insert is they are made up of certain polymeric materials. This polymeric materials holds the drug molecule and they releases the drug with the help of the tears. With the help of the tears, the tear may be permeated into this ocular insert and it may dissolve the drug, and the drug may be slowly come out of the ocular insert and it is slowly releasing into the posterior cavity as well as anterior cavities of the eye. So this reduces the dose loss, reduces the loss of the drug. Reducing the loss of the drug will reduces the frequency of administration. So this way it improves the patient compliance. So what are the characteristics of the Ocuserts? It should provide sufficient comfort for the patient. That means we are inserting something to our eye, so we should not feel that something is sitting on our eye, I'm not able to view visually, proper vision is not there, or it feels like something is sitting on the eye and it provides some error. Such things should not happen. Okay, so it should give the proper comfort. Then the lack of explosion, ease of handling and insertion, non-interference with the vision, and oxygen permeability. This point we'll discuss again. Then reproducibility of the release kinetics. That means release kinetics means what? At what rate the drug is releasing out of the device. At what rate? each time point what rate it follows. So this rate should be same. It should not vary from product to product and from time to time. So the what rate it releases the drug initially in the beginning, at the same rate it would able to release till the end. And when we develop different types of Ocuserts also, all the Ocuserts should able to release at the same rate. That is a reproducibility. Then sterility, stability, and ease of manufacture. So these are some of the basic criteria of a ocular insert. Now, this ocular inserts can be of two types. First one is erodible, second one is non-erodible systems. Erodible systems, once we inserted into the eye cavity, it will slowly erode and it will release the drug. Whereas in the non-erodible, the polymeric material will not erode into the eye, whereas it will releases the drug, but the polymeric material will not be eroded. So they are under the non-erodible systems. So it's only non-erodible systems. Okay. Now, the non-erodible systems are of two types, that is Ocuserts and contact lenses. These two non-erodible systems we are discussing in this session. So Ocuserts, it's a flat, flexible, elliptical device. It releases the drug at a zero order rate, especially for the hydrophilic drugs. An example of this Ocusert is pilocarpine Ocusert, produced by the ALSA Corporation. Let us see what is the pilocarpine Ocusert. So this pilocarpine Ocusert, if you look into this picture, it is having in the top and the bottom a transparent rate controlling membrane. In the top and the bottom, a transparent rate controlling membrane. Over the bottom rate controlling membrane, there is a ring of titanium dioxide, which in other way act as a frame for your drug polymer matrix. The center layer is the drug polymer matrix. So totally 4 different layers. It comes under the category multi-layered. The first and the last layer is the rate controlling membrane. The characteristics of this rate controlling membrane is it is transparent nature, because it has to permeate the light, it has to penetrate the oxygen, it has to penetrate the water, means the lacrimal fluids. So it should be permeable enough. At the same time, it should be transparent, it should be rate controlling. So in this Ocuserts, two layers are of transparent rate controlling. The central layer is the polymer matrix. It is fixed to the frame of titanium dioxide ring. So simply we can say that the drug polymer matrix is sandwiched in between two transparent rate controlling membrane. So this is the parts and how the pilocarpine Ocusert is being developed by the ALSA Corporation. The microporous membrane permeates the tear fluid to penetrate into the drug reservoir system, and it slowly releases the drug. And the higher release rate is been achieved by making its rate controlling membrane a thinner and by use of a flex enhancer. So what happens? The tears, once it penetrate the transparent membrane, the tears penetrate, it enters into the system, it solubilizes the drug layer. This drug further again penetrate the membrane and it releases into the cul-de-sac. Now two types of Ocuserts are available in the market, that is Pyro 20 and 40. And these devices are most popular in the younger patients, compared with that of the elder population, considering the difficulties for insertion, because this ourselves can be inserted at any point of time. So the clinical studies proves that this drug effectively controls the increased intraocular pressure in the glaucoma with a minor incidence of side effects such as miosis, myopia, etc. So this is the clinical significance. The main advantage of the ocular inserts includes the higher residence time and the slow and a constant release of the drug from the delivery system. How long if we want to keep the Ocuserts in our eye, we can keep it and it releases slowly. So long residence time, which helps in reducing the frequency, and slow and the constant release, which may reduces the side effect and which will increases the therapeutic activity. The third advantage is accurate dosing. That's again the constant drug release. How much amount of drug is required to produce the therapeutic activity? Such concentration of the drug can be released from the delivery system. Then reduction of the systemic absorption. Systemic absorption means what? If you are directly administering the drug as a solution or a semi-solid preparation, this drug can enter into the nasolacrimal duct and it can enter into the systemic circulation. So such type of loss of the drug through the nasolacrimal duct is not happening in this case, because here it is a constant release, slow release, and what amount of the drug is released, it can get absorbed into the anterior and the posterior segment. Better care patient compliance. Then low incidence of visual and systemic side effects and targeting the intraocular tissues. So lower incidence of visual and systemic side effects means what? Because here it is made up of transparent membrane, and this membrane also allows the permeation of oxygen, because the eye requires sufficient oxygen to be permeated into the cornea, through the cornea. So if this membrane is not permeating, again this membrane, this duct layer may act as a barrier. So since it is not acting as a barrier, since it is permeating, it's sufficiently permeating the oxygen into the cornea, there is no side effects, of course. The increased shelf life, exclusion of preservatives, and various levels of polymers can be incorporated, and modern technological methods can be adopted in order to make this delivery system a more effective one. So this way the ocular inserts becomes highly popular. Some of the disadvantages include the initial discomfort, because a person who is not inserted into the eye, who is inserting for the first time, surely will get some discomfort. Secondly, loss during the sleep, while sleeping, and interference with vision and difficult placement, because if it is not properly placed, because if we have placed the contact lenses in the eye, it should be exactly placed. It's something like a curved elliptical shape. It should be properly placed over the cornea, then and there only will be getting the proper vision. If it is not properly placed, if it is not attached directly into the corneal layers, it will affect the vision. So if any difficulty, it's one of the main disadvantages that a person who is not experienced much may feel some difficulty for placing this ocular inserts. The second category is contact lenses. So contact lenses also comes under the non-erodible ocular inserts, where Ocuserts are exactly the delivery systems. Something different is like contact lenses, which is having a dual purpose. So, contact lenses are cross-linked cross-linked hydrophilic or hydrophobic polymers that forms a three-dimensional network capable of retaining water, aqueous drug solutions or solid components. So the first characteristics of this contact lens is they are covalently cross-linked with either hydrophilic or hydrophobic polymers. So the bond is formed covalently. They are cross-linked that make it more stronger. And third, it forms a three-dimensional network. Because of this three-dimensional network, it is capable of retaining much of the drug and aqueous solution in this network. So this contact lens is having a wide applicability that many people are using the contact lenses nowadays. Now, how to incorporate the drug into the contact lenses? So, five different methods is adopted to incorporate drug into the contact lenses. These strategies include: first, soaking of lens in the drug solution; secondly, copolymerization; third one is immobilization on the contact lens; fourth one is molecular imprinting; and fifth one is supercritical solvent deposition method. Let us discuss one by one. So the soaking of lens is the most simplest way for producing the soft contact lenses. So these soft contact lenses can be soaked into the preferred drug solution. So slowly the drug molecule may permeate and it may attach into the contact lenses. Finally, this contact lenses becomes a depot of the drug molecule. It's by again the passive transport of the molecules. So these delivery systems can be developed for pilocarpine, antibiotics, timolol, dexamethasone, etc. So these drug molecules are incorporated into the contact lenses just by soaking the lenses. The second method is copolymerization of the contact lens hydrogels with the functional monomers. So in preparation of the soft contact lenses, the monomers interact with the target drugs into the hydrogels. As we know, the polymers, see, in the initial session we discussed, while preparation of this contact lenses, they are made up of either hydrophilic or hydrophobic polymers. Polymers are prepared from what? Polymers are prepared by polymerization of monomers. So monomers are individual units, where polymers are the cross-linked form of monomers. So the conversion of the monomers by polymerization to form the polymer. So this process, the copolymerization of the contact lens with the functional monomers, means what? Once, while preparing the polymer for the contact lens, while during the process of polymerization of monomers itself, we can incorporate the drug into the monomeric system. So this will hold the drug molecule into the monomers, and this monomers itself can act as a depot for release of the drug. Especially the cationic monomers such as metacrylamide used to enhances the loading capacity and extends the release of anionic drugs such as ion exchange reactions. And once we keep the or administer the contact lenses, the tear fluid ions, because in tear fluid it is having so many ions. So these ions compete with the drug for the ionic group of hydrogel and the drug is released. So you can think of it here, the monomer is cationic in nature. So the cationic monomer can adhere or bind to anionic drug molecules. Now what happens? The cationic monomer during the polymerization binded with the anionic drug molecules. Our tear fluids having many main ions. These anionic ions can again bound with the cationic monomers. Because of this interaction, there is exchange of ions happens. Because of this ion exchange between the ions of the tears and the cationic ions of the hydrogels, it releases the anionic drug molecules. So here purely what happens, the ion exchange reaction of the drug and the ions of the tear fluids happens. The third one is immobilization on the contact lens surface of drug-loaded colloidal nanoparticles. So here the drug-loaded nanoparticles are immobilized into the surface of the contact lenses, and these drug molecules are can be entrapped in large amount and then being dispersed in the lens material during the polymerization. So immobilization techniques you have learned in biotechnologies and microbiology. So likewise, the nanoparticles or the colloidal suspensions of the drug has been separately prepared and it is been immobilized over the surface of the contact lenses. This can be done during the process of polymerization also. So these nano capsules prevent the interaction of the drug molecule with the polymerization mixture and provide a resistance to drug release because it's incorporated inside a nano capsule. So from this nano capsule, for the drug molecule to release out, initially it should diffuse through the nanoparticles and penetrate the particle surface into the hydrogel matrix. And these colloidal particles loaded contact lenses can deliver the drugs at a slow rate for a longer period of time. So initially here the drug molecules, the colloidal suspension or nanoparticles of the drug has been immobilized. The drug is present inside a nano capsule. The drug has to penetrate the nano capsule to release out of the system. So because of this rigid nano capsule system, it provides a slow and consistent release over a longer period of time. The fourth one is the molecular imprinting. So in this method, the components of the hydrogel networks are organized in such a way that the high affinity binding sites for the drugs are created. Drug is added before polymerization and the monomers should arrange as a function of their ability to interact with the drug molecules. So here also, while preparing the polymerization or while preparing the polymers into the monomers based upon the affinity of the drug with the monomers. So the affinity of the drug and the monomers is taken into consideration. So the drug that is having binding site or more affinity with the monomers has been selected, and this drug will bind with the monomers based upon its affinity, and it has been added before the polymerization, and we are preparing the polymer here, and this polymer has been utilized for administration. The last method is the supercritical solvent deposition method. So in this method, the drug is dissolved into a compressed high volatile fluids. Compressed high volatile fluid. Example is carbon dioxide. And then contact the resulting mixture with the polymeric mixtures to be loaded. So this initially the drug is dissolved. Initially the drug is dissolved where drug is dissolved in the compressed high volatile fluids, and example is carbon dioxide. This fluid is then further mixed with the polymeric mixes to be loaded. So such type of dissolving drugs in the supercritical fluids. So this method you may be learning later what is supercritical fluid method. So here the drug is being dissolved in the supercritical fluid, example is of carbon dioxide, and with the help of that this further dissolved in the polymeric system and it's developed as a contact lens, which helps in slow release of the drugs. Then physical properties of the contact lens drug delivery system. So the physical properties include transparency of the lens, then oxygen permeability, glass transition temperature, wetability, and water content. So these are some of the physical properties of the contact lenses. That is, transparency, it should be transparent enough, it should allow oxygen, it should have a glass transition temperature, it should have sufficient wetability and water content. So the transparency of the lens, because it should have sufficient clarity, then and there only it can permeate the light and to get the better vision. Oxygen permeability, again sufficient oxygen is required for the cornea. That means we are keeping the contact lenses, it should able to provide proper permeation of the oxygen. If not, it act as a barrier, it will damage the corneal cells. Glass transition temperature is again another thermomechanical property, because this glass transition temperature becomes more important. So if the polymeric material what we are using do not have sufficient thermomechanical property, it may change the mechanical property after inserting into the ocular cavity. Such changes in this physico-mechanical property may affect the ocular cavity. It may cause any sort of side effects. So in order to keep the safer, the soft, even though a rigid in the sense good rigid, so that it should retain its appearance. So as we see the contact lenses, they are of round, it's elliptical in shape, and also it should provide certain mechanical properties to keep its shape, size and the properties same for a longer period of time. Wetability is again another property which keeps the product stable in the cornea, in the lacrimal fluid for a longer period of time, because if it's wet only, it will release as the drug molecule. So wetability measures how its amount of drug, its amount of fluids this can take up. If it is not wettable, means it will not release as a drug. If it is wettable, it slowly takes up the lacrimal fluid. With this lacrimal fluid, the drug may be dissolved and it may be released further. So wettability is one of the important factor considering the release of the drug molecule. Next is again the water content of the contact lenses. So the water content can also affect the oxygen permeability of the drug molecule, and the hydrogels, as we know, it is made up of certain hydrogels. So the contact lenses is a basic characteristics that since it is made up of these hydrogels, it should be hydrated enough, then and there only it can keep its shape and size for a longer period of time. If it is not dry. If it is dried much, if it is dried, it may be powdered. It will not retain its shape, it will lose its transparency, and it may be unsuitable for administration. So it should able to hold the sufficient water content, which will increases the life and stability of the contact lenses. Also it helps in oxygen permeability. Okay, now such type of contact lenses has been utilized for treatments of antibiotics, then corneal injury, allergic conjunctivitis, dry eye, as well as glaucoma. Okay, so that's all for today. So thank you. So go through the session. If any clarifications, we'll discuss further. Okay, thank you. Bye.